When you work in coronary care units or in an emergency department, as well as in some other placements, you might be asked to do a 15-lead EKG or a posterior EKG or a right-sided EKG. So now there are different variations of EKGs that we can do from a regular 12-lead. So it's always a good idea to confirm with your physician what it is exactly that they want to view when we are talking about the planes of the heart. As you recall, a 12-lead EKG usually views the anterior, septal, and a little bit of lateral and inferior parts of the heart. And when somebody asks you to do a 15-lead EKG, they're usually looking for a posterior view of the heart, which is really in the back and lower bottom that cannot be seen with a normal 12-lead EKG. A right-sided EKG would be done on the right side of the patient's chest, very similar to the left-sided EKG, and that will really visualize the right ventricle of the heart. A posterior and a 15-lead will be looking more at a posterior and lower bottom of the heart. So I will show you how to do a 15-lead first. We can start with a normal 12-lead EKG position for our precordial leads. And what I need to do first is actually to do my 12-lead EKG. So I will place all the stickers, I will push EKG, I will print my 12-lead EKG. From here, I will need to switch some of the stickers. From the name 15-lead, that means that we actually have 3 extra leads that we're adding to the 12 leads. Let's say I've already done my 12-lead EKG. What I'm going to do is I'm going to remove the last 3 stickers, so V6, V5, and V4. And what I'm going to do is I'm actually going to move them to a different place to be able to visualize a different plane of the heart. My V4 becomes a V4R, R stands for right, and it will go in the exact same position as the V4 on the left, but it's actually going to go on the right side of the patient's chest. So mid-clavicular, fourth intercostal, if you can get there. On a woman, you might not be able to get exactly where we want to go, but as close as we can. Then for the 15 lead, we will have to ask our patient to turn, and we're going to place the rest of the stickers on the patient's back. And it's important to remember that this will be the right side of the patient. So one of them will go in the mid-scapular area, and you still try to stay in the 5th intercostal space as much as you can. Okay, and then the other one, we will still try to stay in the 5th intercostal space, but it will go in the posterior axillary line. So then what you would do, you would attach your electrodes, and you see that the rest of the stickers I kept as is, and the only stickers that I changed are V4, that becomes V4R, V5, and V6. So V5 becomes V7, and V6 becomes V8. And I will show you on an EKG paper how to change those. After that, after you've repositioned your stickers, you can click EKG and you can print your EKG paper.